Hello, just here to talk about the flu vaccine. So it's very important for people to get the flu vaccine. It can be a very nasty illness to get it. People have forgotten how nasty it can be since COVID, but it can cause very serious illness and hospitalisation for vulnerable people. So there are certain people who are eligible for a free NHS flu vaccine, but other people who may wish to have it, you can get it privately as well. So the sort of people who are eligible for a free one would be people with chronic illnesses, so respiratory diseases like asthma, COPD, people with chronic heart conditions, kidney disease, liver disease, diabetics, and people who got a suppressed immune system, so undergoing chemotherapy or on other kind of therapies like that. Also, people who have had a spleen removed, and people with morbid obesity as well are entitled to a free flu vaccine. Also, there are some non-clinical groups, so obviously healthcare workers, frontline healthcare workers, like for example in pharmacies, in doctor surgeries, if you're working in dental surgery, or you have sort of one-to-one contact with people on a daily basis, you'd be entitled to a free flu vaccine as well. If you're a registered carer, you'll be allowed a free flu vaccine as well, obviously to protect the people you're caring for. And also if you live in a household with someone who's got a suppressed immune system, again, you'll be entitled to a flu vaccine. And last but not least, pregnant women, obviously, that's very important for if you're pregnant to get a flu vaccine, because it can cause complications during pregnancy. A lot of people, probably one of the most controversial groups, and a lot of people don't want to come forward for a flu vaccine if they're pregnant, but it's perfectly safe. It's been tried and tested for many, many years, and it will protect you from serious complications of flu during pregnancy. So obviously, some of the common myths about the flu vaccine: it can't give you the flu. It's an inactivated vaccine, so they take the flu virus and they inactivate it. They usually with heat or chemicals they kill it. But so the flu vaccine mimics the virus, but isn't the live virus. So that's the common myth. In terms of side effects, obviously it might get a bit of an achy arm. Some people do react a little bit with a high temperature to it, but it should be nothing worse than that. It takes a couple of weeks to actually come up to its full strength in your body. So obviously it's not impossible to catch the flu straight after you're having the flu vaccine, but if you get it the earlier you get in the season, the better, because the main season is towards the end of November, December, January time is when the flu really hits the UK. So the earlier you get it, the better.